Victoria's new coronavirus cases have risen into the triple digits again today as negotiations continue over extending the state of emergency. Leanne Wong is in Melbourne. So Leanne, just take us through what the latest numbers are there in Victoria today.
Yes, good afternoon, Miriam. I think an increase to the triple digits is a number that most Victorians didn't want to see, but the Premier Daniel Andrews today has again insisted that the strategy is working. Victoria has recorded another 114 new coronavirus cases and sadly another 11 deaths, bringing the state's death toll to 524. Now, of those deaths, 9 are linked to aged care outbreaks, and that means that now 382 deaths in Victoria are linked to just aged care outbreaks alone. Now, in regional Victoria, there are currently 166 active cases, and that's a decrease of 11 from yesterday, and certainly a decrease from 2 to 3 weeks ago, where we saw the number of regional cases be in more than 500 cases, and active cases are still below 3,000. But despite that downward trend, the Premier has again said that it is far too early to provide Victorians with a detailed roadmap of what they can expect in 2 weeks' time when Stage 4 restrictions in Melbourne come to an end. He's again compared the pandemic to a public health bushfire that is still smouldering and says Victorians need to stay the course.
At 100, at 94, at 114, whatever the number around that number, we simply could not open up. Those numbers would explode. We would finish up in perhaps an even worse situation than we have been in recent months, and we can't fritter away all of that good work, all that sacrifice, that pain, the challenges that every Victorian has endured and worked through. We can't have that count for nothing.
Daniel Andrews there. And Leanne, what are authorities saying in general about the ongoing impact of the pandemic?
We heard from Dr. Andrea Rhodes today, who's from Melbourne's Royal Children's Hospital, who expressed her concerns that parents are possibly delaying treatment for children out of fear of coronavirus. She says from a study in a survey of over 2,000 Australian parents that about a third of children who have been injured or unwell during the pandemic have had their healthcare, in fact, delayed by that parent. And in fact, 1 in 5 children under the age of 5 years has had a routine vaccine delayed since the onset of the pandemic. She says the main reason that parents have given for delaying care was fear or concern that their child would catch COVID-19. And she wants to reassure parents that healthcare facilities are in fact safe. Dr. Rhodes says that the last thing that we want to see off the back of the coronavirus pandemic are outbreaks of other preventable diseases.
And Leanne, is the Andrews government still looking to extend those state of emergency powers?
Victoria's state of emergency powers come to an end on September 13, so that's in just 2 weeks' time. Now, the Premier Daniel Andrews today said that the government was in productive discussions with crossbench MPs, but they've yet to reach an agreement after a number of crossbench MPs have resisted the Premier's plan to extend those powers by a further 12 months. Now, a number of crossbench MPs have instead thrown their support behind Reason Party leader Rosie Patton's plan to rather extend a proposal bid to extend powers by 6 months rather than 12 months. Now, the government says that it's going to continue to those discussions with crossbench MPs, implying that a future compromise may be on the table.
Our reporter Leanne Wong there with the latest in Melbourne. New South Wales Health have recorded 7 new cases in the last 24 hours, taking the state's total to 3,851. Of the 7 new cases, 5 are linked to the City Tattersalls Club cluster in Sydney CBD. 1 case is a traveller in hotel quarantine and 1 other case is under investigation. A student from St Paul's School at Greystanes is among today's new cases. New South Wales Health says the school will be closed tomorrow.
The school will be closed on Monday the 31st of August and cleaning and contact tracing is underway. 5 of the new cases are linked to the CBD cluster. 1 is a household contact of a previous case. 2 new cases attended the City Tattersalls Fitness Centre. The total number of cases linked to this cluster is now 28.
Queensland has recorded 4 new cases of coronavirus, all with links to known infections in the state's southeast. There are now 28 active COVID-19 cases in the state. Reporter Anna Hartley joins us now from Brisbane. So Anna, what do we know about these latest cases in Queensland?
Hi Miriam. Look, we know, as you say, there are 4 active cases overnight in Queensland. Now 3 of those were in the Forest Lake area, all in the same household, who lived with someone who had previously tested positive for the virus. Another was in Collingwood Park and was a close contact of someone who again has been tested positive for the virus. It's believed to be part of one cluster. Now, I'm at Fig Tree Pocket in Brisbane's west, where this childcare centre is one of the 120 places where public health alerts have been issued. A child at this centre was tested positive for the virus. We've had another case at Ipswich at Staines Memorial College where a male student has also tested positive, and again contact tracing is underway. Now, as you mentioned earlier, there are 28 active cases now in Queensland, and that brings us up to 1,121 total cases in the state. Now, the Chief Health Officer today told us that more than 10,500 people have gotten tested for the virus in the past 24 hours. But even with that high testing rate, she's not confident that this cluster will be contained, and says we should expect more positive cases as the days roll on.
Well, with that expectation, Anna, what's happening with restrictions there in Queensland?
So there are current restrictions of outdoor and indoor gatherings, a maximum of 10 people in pretty much all of the southeast. So right now it's the Brisbane, Gold Coast, Cherbourg, Goondiwindi, Ipswich, Lockyer Valley, Logan, Moreton Bay, Redland, Scenic Rim and Somerset regions where those restrictions apply. But from 8 a.m. tomorrow, with the recent cases, that will be expanded to Toowoomba, the South Burnett, Western Downs and Southern Downs Council areas. Now, at the moment, weddings and funerals who do have a COVID-safe plan or events with COVID-safe plans can have up to 100 people. But again, we're just waiting and seeing how things continue here.
And Anna, just how concerned are health authorities in Queensland for the coming weeks?
Look, as I mentioned, we are better off than a lot of other states, and Queenslanders are aware of that, but there are concerns that this current cluster won't be easily contained. Now, our Chief Health Officer, Jeanette Young, upped her messaging really on the mask situation in Queensland. It's not mandatory, but today she said she strongly encourages Queenslanders, especially those in the southeast, to wear a mask, especially in places where you can't easily distance, like shopping centres. So that messaging is getting stronger, and there are concerns that this cluster will be hard to manage.
We don't have unknown transmission happening in our community in Queensland today, but we have to be alert to that. We have now had over 101 days of infectious people out in our community in the last 14 days. So that means there's been those 101 opportunities for people to get infected. So we know that we will see more cases.
As always, Dr. Young has said the message is get tested no matter how mild the symptoms, especially if you're in the areas of concern. Testing will be critical to containing this current cluster in Queensland.
Our reporter Anna Hartley there with the latest in Brisbane. The WA President of the AMA is calling for the state government to adopt tracking technology for all arrivals into the state after an alleged quarantine breach triggered a COVID-19 scare at a Perth pub on Friday night. Police say a 53-year-old man returned to WA from Queensland without an exemption to re-enter the state. It's alleged he defied an order to quarantine and was found by police soon after at the Hotel Northbridge, which closed as precaution. The man's COVID test has since come back negative. The race to find a vaccine or effective treatment for COVID-19 continues as the global death toll climbs towards 850,000. Director of the Doherty Institute and infectious diseases expert, Professor Sharon Lewin, says research and trials are continuing to make progress, but the safety of any potential vaccine remains a priority.
Russia and China seem to have a different approach to making vaccines available. Neither vaccine in either China or Russia have gone through large-scale tests, what we call phase 3, to work out if they actually protect from infection or protect from disease. So we would never license a vaccine, even for emergency use, without the results of a phase 3 study. And that's because once you put the vaccine in thousands of people, we're talking about 30,000 people, first of all, you may see side effects that weren't apparent in small studies. And of course, the most important thing is that you have to know the vaccine works. It actually protects you from infection or disease. And we certainly want to know that the vaccine doesn't cause worse disease, which is one concern we have about this coronavirus vaccine. It has to be tested in phase 3 trials before we can advise people to use it. So I wouldn't pay too much attention personally to what's being done in China and Russia. We would never license a vaccine based on the data available. There's almost 50 vaccines now in clinical trials, different phases, and 9 in that late stage phase 3, which usually means you need to recruit thousands of people. We couldn't do that sort of study here in Australia. We don't have enough infection around. About 9 agents in phase 3 trials. Back in January, we had no treatments available. All we could do was provide supportive care, oxygen, ventilation, and looking after people's fluid balance. But now we have 2 treatments that are in widespread use in Australia. One of those is dexamethasone, a steroid which dampens the immune response and benefits people when they're pretty sick, meaning when they're on oxygen or on a ventilator. And the other, and that actually reduces mortality by about 20 to 30%. Very, very effective. The other agent that we're routinely using in Australia is an antiviral drug called remdesivir. That's used in people with more mild illness but still in hospital. Perhaps less effective. It's just shown a quicker time to recovery, not yet demonstrated a mortality benefit. They're the 2 agents that we have available, and there are many clinical trials across the country, particularly in Melbourne, looking at new agents to even further improve outcomes.